tube needs to be put back in after extubation or removal of the breathing tube? Stay tuned. I'll have news for you. Hi, my name is Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today I have a question from a client of ours who says, when does the breathing tube need to be put back in after extubation? Extubation means the taking out or the removal of the breathing tube when someone is mechanically ventilated with a breathing tube in their mouth that goes down into the lungs. So the situation is as follows, that our client's son is in ICU and is ready to be extubated, but he's worried that the breathing tube needs to be put back in. And that is certainly a concern for many patients that, move towards extubation. You need to have a plan to avoid reintubation. But what are the signs? And I want to break that down today specifically. So signs that the breathing tube needs to be put back in is high prolonged breathing rate above 30 breaths per minute. So the faster someone is breathing, the higher chances is they're not getting enough oxygen. Another sign is shallow breathing. So if someone is breathing shallow and also is using their accessory muscles like their tummy muscles instead of using their respiratory muscles. Next is shortness of breath, if someone is finding it hard to breathe. Another sign is if oxygen saturation is less than 94% and it's prolonged. It's not a problem if it's only for a couple of seconds or for a few seconds, even if it's only for a few minutes. It might just, patient often might just need some repositioning, get in a better position to breathe. So it's not only a case of looking at numbers, it's also a case of what can be done to improve those numbers. Next is if there's an inability to clear secretion. So what that means is, if someone can't clear their airway, they can't cough, they can't bring up their phlegm, they can't bring up their secretions, can't spit it out, that is also a risk that the breathing tube needs to be put back in. Next, if someone is unconscious and has an inability to breathe, of course, or has an inability to cough or gag because of their unconsciousness. Next, if arterial or capillary blood gases are out of range, that means if PO2, which is oxygen in the arteries, is too low, or if PCO2 is too low. PCO2 is the carbon dioxide. And I encourage you to check out our section at intensivecarehotline.com about arterial blood gases, and I'll put a link below this video. Also, when the breathing tube is taken out, i.e. extubation, and someone is struggling, a way to avoid the breathing tube to be put back in is to use BiPAP, CPAP ventilation with a mask, or high flow nasal cannula, or also chest physiotherapy, right? So those are the signs when a breathing tube needs to be put back in, which is also known as intubation. Now, I have worked in critical care nursing for nearly 25 years in 3 different countries, where I worked as a nurse manager for over 5 years. And I've been consulting and advocating for families in intensive care here at intensivecarehotline.com since 2013. And I can confidently and without the slightest hint of exaggeration say that we have saved many lives, prolonged many lives with our consulting and advocacy, giving families and our clients the tools and the strategies to make that happen. And we have, I'm talking to doctors and nurses directly in intensive care, advocating for our clients. And you can also verify what I'm saying here on our testimonial section at intensivecarehotline.com, or on our podcast section where we've done client interviews at intensivecarehotline.com. It's also one of the reasons why we have made a membership available for families of critically ill patients in intensive care. And you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks, 21 videos that I have personally written and recorded, and share all my experience from decades of intensive care nursing, working with thousands of patients and their families directly in intensive care or here with intensivecarehotline.com. And I'm not holding back, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment. You can't steer this incredibly difficult environment, intensive care, by yourself. You are in a once-in-a-lifetime situation that you simply can't afford to get wrong. I also offer one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through the experience. And I also talk to doctors and nurses directly. And I ask all the questions to the doctors and nurses that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also offer medical record reviews in real time so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com with your questions. Also, if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have. Share this video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you can become a subscriber. And if you become a subscriber of my YouTube channel, you will get notification for that. Or if you become a subscriber of our email newsletter at intensivecarehotline.com, you will get notification for the YouTube live. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.